So, how does stroke and heart disease fit in with our focus on occupation? Firstly, a stroke can adversely affect fine, gross, visual, oral, and sensory motor skills, but to varying degrees depending on how severe the stroke is. For instance, a famous actress, Aubrey Plaza, she had a stroke when she was 20, and now she's fully recovered. My friend, his dad had a stroke, and he's pretty functional overall, but his personality is just not the same. His temperament, he's um, easily frustrated and irritable and pouty. Also, he doesn't really like want to help around the house, which is a stark contrast to what he was like before. Um, Also, everything he does is generally slower. Also, my mom had a stroke 6 months ago, and she was very just always out and about, just always doing things. And after a stroke, her whole left side is like not really functional, so she can't really walk, she can't really stand. She All her occupations are basically non-existent or definitely need the help of someone else. So you can see how like it really ranges. So yeah, stroke patients, they can face difficult challenges with moving around, managing their life around the community, ADLs, um, also cognitive function can be affected. They can be intellectually not the same, or their personality could be different. But generally, OTs try to help these patients gain functionality, whether it's for performing ADLs or self care, hygiene. Um, just the goal is independence for the most part, but we also have to remember we're client centered so that we can't assume they want independence. They might value other things, and it's really ultimately up to them to decide what's important and what they want to work on. But generally, independence is what we strive for, to build their motor skills back to where it was so they can go back to just living their life. Moving on to heart disease. Heart disease encompasses a variety of heart related issues. Two primary issues are heart attack and cardiac arrest. Heart attack is when the blood flow that's carrying oxygen to the heart, it gets blocked. So the heart doesn't get the oxygen that it needs. And so the heart muscle can die. Um, Cardiac arrest can happen. It can happen more likely after a heart attack, and it's pretty scary because you can you can die pretty easily because your heart just stops beating unexpectedly. So hopefully you have an AED around, or you're near a hospital of some sort. But the OT's role in this is, a lot of this is trying to prevent further issues, because once you have one, you easily have another. And so it's about helping them get back to their normal occupation, driving, walking, and also managing their physical activity. It really depends in this situation how much they can handle. Um, so it's up to the OT to decide how active they should be. Also managing their diet and how they eat and how they carry on working their life back into their normal lifestyle. And all that is important for their heart health.